Basically, I remember this as SAD, S-A-D, that you're sad that you got to learn all this. But once we put the bones together, we're understanding these articulations or joints by function. In other videos, we'll look at it by structure. How do we connect them? But we start with just synarthrosis, means no movement. Amphiarthrosis is a little bit of movement, and diarthrosis is a lot of movement relative to each other. So an example of synarthrosis are all of my sutural joints. Remember, my sutural joints are dense fibrous connective tissue, but as I connect these bones, they're not designed to move. So we connected bones, but their function of movement is synarthrosis. A little bit of movement, amphiarthrosis, and we tend to see cartilage in this case, hyaline and fibrocartilage. When we see hyaline cartilage, we call them synchondroses or synchondrosis joints. When we see them as fibrocartilage, we call them symphyses or a symphysis joint, and that's by structure. So when I look at this, we're looking at an example of a vertebrae. In between the vertebrae, I have an intervertebral disc. This is fibrocartilage, and it gives me just a little bit of movement as I sway and use it as a shock absorption spring, because it said fibrocartilage, a shock absorption. So amphiarthrosis, a little bit of movement. Another good example is my sternum to my ribs. I connect it with costal cartilage, and that's hyaline cartilage. That's a synchondrosis joint by structure, but its function is amphiarthrosis. So as I breathe, I get a little bit of movement. That's amphiarthrosis. And then lastly, diarthrosis is a lot of movement relative to other joints. In this case, we're using the example of the femur to the hip. So we're connecting at the acetabulum, remember, at that lateral surface of the acetabulum. We'll see what's called a synovial joint there. So we have a synovial membrane that produces a fluid called a synovial fluid that helps lubricate and nourish the joint so it can move quite a bit. And then we'll often see articular cartilage there to help with that constant movement.